Hi, everybody. This is Susan Henderson from DREDF. Let's go ahead and get started, and I'll just let people in as they arrive. So thank you for joining us today. This week's question and answers on COVID-19 is with pediatrician Dr. Larry Yin, who is joining us from, let's see, I found a lot of different, let me just put it this way, I found a lot of different affiliations with you. But you're very accomplished, very driven, very passionate pediatrician for kids with disabilities, and we appreciate that. So I think I'll let you go ahead and when you introduce yourself, list the affiliations that mean the most to you, if that's okay.
Okay, that sounds great. Do you want me to go ahead and start sharing my screen?
No, I have a couple more slides. Just
okay.
Quickly. Here we go. Let's see some image. So what's going on here? Okay. First, we have Spanish interpretation by Leticia. So in order to access it, there's an icon that looks like a little globe at the bottom of your screen. Click on that, select Spanish, and then you'll be able to hear Leticia.
Come on, you've had enough of a break now. Jenny, you should be seated
Zoom
in one place to do that, not all
access for closed captioning.
I've disabled your video. We'll leave the tape on there for now in case it comes back on again.
Whoops.
It was doing it because you weren't completely logged in.
Let me see. Can everybody mute themselves?
I just didn't want to be on camera doing that.
Maybe that worked. Okay. For Zoom access, there's closed captioning by Tony today. The captions will appear at the bottom of your screen if you click on the CC icon. We also have ASL interpretation by Brandon. You should be able to see his video right now. It says ASL interpreter Brandon. If you click on him and up at the right-hand corner, there will be 3 dots and select pin video. So then you'll always be able to see him. And the same is true for Dr. Yin. If you need to make those video windows larger, you can grab the little bar at the side of the slide and move it to the left so you can see the folks a lot more better. Next, please keep your mics muted and your cameras off so it's easier for us to hear the presenter and see their faces, and Brandon too. We'll answer questions at the end of the presentation if you were submitted ahead of time. But anyway, I'll stop sharing now and I'll hand it over to you, Dr. Yin.
All right, so let me go ahead and share. Share this. And here we go. And are you seeing my whole thing, or?
We're seeing it.
Okay. All right, so good afternoon, everyone. My name is Larry Yin, and I'm the interim division head for general pediatrics here at Children's Hospital Los Angeles. I'm also an associate professor of clinical pediatrics, as well as a developmental behavioral pediatrician. So I do both general pediatrics and developmental and behavioral pediatrics. And it's my great pleasure to provide a forum today to talk a little bit more about COVID-19 vaccine, and more importantly, answer some questions that you may have, and hopefully I'll have the answers to, and really hopefully we have a rich discussion around all of this. So before I get started about how COVID-19 vaccines work, I just want to give you a quick update around COVID cases in the United States. Currently, there's been over 33 million people infected with COVID, with 100,000 new cases in the past week. And more tragically, almost 600,000 deaths related to COVID-19. So, you know, what we're hearing in the news, what we're feeling each day, that things are getting better, that is true, but this is still an issue that's ongoing for many families dealing with COVID. In California, we have about 150 new cases each day, and over 4,000 cases, about 4,000 cases over the last week. And in terms of vaccines, we've done a pretty good job in the US. Over 300 million doses given and 142 million people fully vaccinated. And that reflects roughly 43% of the population. In California, we're at 45%, so a little bit better in terms of folks fully vaccinated, with 40 million folks having received at least one dose. So more room to go in terms of all of that. But in terms of understanding how COVID-19 vaccines work, it's really our body's ability to fight off infection and fight off COVID. And there are 3 types of cells that are involved in this process. Macrophages, which are the name for cells that really eat and digest germs, dead or dying cells. But more importantly, what they do is they leave behind what are called antigens or proteins that are then eaten by these antibodies that then create some of that memory. B cells produce cells that attack pieces of the virus left behind by these macrophages, and they also develop memory. And then T cells also attack cells that have already been affected. And again, providing that memory for your body to be able to fight off new infections. So when a person gets infected, they fight off these infections with these 3 types of cells. And then our body then remembers this for the next time. And so for COVID-19 vaccines, it really helps the body get ready to fight off an infection without you having to get fully sick or ill from an infection. The vaccines usually take a few weeks to build up the memory in these cells. And then the process of getting ready to fight infection is really what causes folks to feel tired or having fever or essentially not feeling well. So types of vaccines, there are several. The mRNA type of vaccine contains part of a virus that codes for parts of the virus that cause COVID-19, and it really tells our body how to fight. Our bodies then destroy those parts of the vaccine, but now we have the memory to fight again. Protein subunit vaccines also contain parts of the virus that cause COVID-19, and again, once immunized, your body then remembers how to deal with that infection the next time around and destroys them and obviously creates memory. Vector vaccines are another type of vaccine that contain parts of a virus that cause COVID-19, but it's inserted into a different weakened virus. So it's a virus within a virus. And then once immunized, we make protein that's unique to COVID-19, and our bodies make copies of those proteins to then fight again. And we react by building these cells, remembering what we've been exposed to, and then fighting it off once we see those types of infections again. So for the Pfizer BioNTech COVID-19 vaccine, it's approved for ages 12 and above. It's an mRNA vaccine. It requires 2 immunizations 21 days apart, typically given in the upper arm. And the typical side effects are pain, swelling, and redness. With some folks report chills, tiredness, headache, and fever. It does not contain eggs, preservatives, or latex. The contraindication or the reason why one would not receive this vaccine is if you've had a severe reaction or an immediate reaction to any ingredient in the vaccine. And the ingredients that are listed in the vaccine are listed on the CDC website, as well as the manufacturer website. The Moderna vaccine is a COVID-19 vaccine, is also an mRNA vaccine, and it's been approved for folks 18 and above. This also requires 2 immunizations, 28 days apart. It's given in the upper arm as well. Similar side effects, also similar in that it doesn't contain egg, preservative, or latex. And similar types of contraindications, meaning if you've had a severe reaction to this vaccine in the past, or an immediate reaction within 4 hours to any ingredient in those vaccine listings. And then the other vaccine used in the US is the Janssen or Johnson & Johnson COVID-19 vaccine. This is also approved for folks 18 and above. This is a vector vaccine, and it only requires one immunization. It's given the same area. Side effects include pain and swelling, chills, and tiredness. You may have read cases of something called thrombosis with thrombocytopenia, which is a fancy term for low platelets in the blood. And platelets are the elements in the blood that help you clot. And it has been reported in mostly females ages 18 through 49 who have received the Janssen COVID-19 vaccine. And in a few cases, folks who've had these complications have passed from this. So the biggest thing to remember is that recipients of the Janssen vaccine should be instructed to seek immediate attention if they develop shortness of breath, chest pain, leg swelling, any kind of abdominal pain, or any kind of neurologic symptoms that would include severe headache or persistent headache or blurry vision. And petechiae are a medical term for these red dots that you might develop on your skin that occur beyond the site of vaccination. And then this vaccine also does not contain eggs, preservatives, or latex. So in terms of the question around who should be immunized, we're hoping to immunize everyone over 12 right now. And to think about the folks who are over 12 with underlying medical conditions as folks who really should be immunized against COVID-19. And I'm just providing a list of the medical conditions considered high risk if you are infected with COVID-19. And then obviously children greater than 12 who have intellectual or developmental disabilities are also important recipients to receive this to protect themselves against future infection from COVID. And I wanted to really kind of keep it brief and leave the rest of our time for folks to answer questions and discuss any concerns that one may have with COVID, either COVID or the vaccine. And I'm going to stop sharing my screen so we can talk.
Okay, thanks, Dr. Yin. I'll start off with this is Susan Henderson again. I'll start off with a couple of the questions that people submitted ahead of time. And if you're here and you want to ask a question, you can either put something in the chat to let us know that you want to ask a question, or use the reactions to raise your hand, and we'll get you in there. So the first question, it was asked a couple of times, was how soon do we expect to see the vaccine become available for children under 12, at least the kids 5 to 12 years old who are in elementary school?
Yeah, I suspect, well, the trials are ongoing and the trial results so far are pretty good in terms of success. So I would expect to see something no later than the fall.
That's great. I know that a lot of people have that question related to their kids returning to school.
Correct.
So this, do COVID vaccines affect autistic children in different ways? And do you know if there were autistic folks in the clinical trials?
I don't know if children with autism were in the clinical trial. Because this is an mRNA vaccine that doesn't get incorporated into any DNA, I would not expect it to impact symptoms of autism spectrum disorder. What I would expect is that you may have someone who becomes, ill from the side effect of the vaccine, may have behavioral responses that might become more challenging. So folks who have intellectual developmental disabilities, dealing with pain at the injection site or dealing with fever or not feeling well for one day after infection, we want parents to be, observant of those types of things, but not necessarily specific to children with autism spectrum disorder.
Okay, and then this person was wondering about the safety of an experimental vaccine for children who already have brain inflammation.
Yeah, and so, for the population that has already been immunized 16 and above, we know the brain continues to develop well into your 40s. And so for those who have intellectual developmental disabilities that have received the vaccine, we have not seen any side effects in terms of, long-lasting issues related to their, or contributing to their underlying disability.
Okay, and then Maria just sent a question in the chat. What are your thoughts on the recent reports of cardiac inflammation in some teens who have been vaccinated?
Yeah, and that seems to be the big story right now in terms of teens who are getting vaccinated is something called myocarditis, which is that inflammation of the heart after the second vaccine. This has occurred in kids 16 to 30, and it's affected about 250 folks out of obviously millions who have received the vaccine. And for the great majority, so the last data I looked at, 270 out of 285 who had the myocarditis or inflammation actually went home from the emergency room with an anti-inflammatory to recover from home. The 15 folks that were studied were still in the hospital at this time, with a small proportion of folks in the ICU. So again, it's looking at direct cause, and that information is still coming out. But I think that the risk of getting COVID is much higher, and the complications related to COVID are also much higher than the side effects related to inflammation around the heart related to the vaccine.
Okay, and so what is the risk for children who have an autoimmune disease who are under 12 going back to school if they're not vaccinated?
Yeah, so kids under 12 going back to school unvaccinated, you could look at data from the UK around schools, as well as some of the data in the US now, where schools have resumed, and the child-to-child transmission is pretty much very low in terms of kids getting other kids sick. The major risk that we see with schools is adults giving children infection. And so we really want to have adults and the teachers or the folks at school who are taking care of our kids immunized so that we don't pass the infection down to children. Most of the infections that we see still are from adult to adult transmission. And it's not typically in the schools, it's adult to adult transmission when folks are at home. And so our risks for kids who have autoimmune disease, who are going back to school unimmunized, basically less than 12, I think the risks are decreased when the older folks are immunized, because the risk of transmission, again, child to child, seems to be very, very low.
Okay, and what if this is a behavior question. So what if a child refuses the second immunization after the first?
Yeah, that is a much harder question, right? Because to really be fully effective, we want to have 2 doses in. Some folks, for those 18 and above, have opted for Johnson & Johnson because it's only one dose. But I suspect over time, we're going to start to see the Johnson & Johnson vaccine available for those 16 and above, 12 and above as well. I think the issue around shared decision-making, working with your child about the importance of becoming fully vaccinated and fully protected is the discussion to really have with your child, and also, again, how to help them overcome the fear of the immunization.
Okay, and then there are a few, and I don't know if you've been listening, been in tune with the education system, but there's a few questions related to schools. And one is, do you have any inkling whether schools are going to require vaccinations when they're available to each age group and possibly refuse in-person learning if children aren't vaccinated?
Yeah, I think that's going to be, well, obviously state to state variability as well as district to district variability. There already is a vaccine mandate to enter schools, outside of COVID vaccines. And that bill's been in California now for several years, requiring schools or for requiring parents to show vaccination status. I don't foresee COVID-19 vaccination being a requirement to show proof of vaccines to return to school for children. I think I have not seen the latest resolution from LAUSD and the teachers union around this. But I understand that there was an announcement made today that there was some agreement about return to school for in-person learning. I do understand that our children with intellectual developmental disabilities or those who are receiving special ed supports have been really affected and impacted by virtual learning and on-screen learning. And just for my own patient population, it's been so difficult to continue to hear the same story, that the resources available through special ed have not been present over this last year, especially through tele-education, and that many of our older children have just become so frustrated with on-screen learning that they refuse to participate in school, and they've lost that ability to socialize with their peers. And I think that the sooner we can get back to person-to-person, face-to-face learning in the school environment, getting back to the routines, our children receiving special ed supports will also benefit from all of this as well.
Okay, and what would you tell a parent if how should a parent talk with their school, their principals, if they want to be able, if they don't want to send their child back to school, if they're unvaccinated because they're under 12 or even older and unvaccinated, to be able to make sure they get the services they need?
Yeah, that's a harder one, I think, as a uniform answer, because every district operates a little bit differently. Every district interprets the rules a little bit differently, at least in my experience. I think that obviously some parents are going to be reticent to send their unvaccinated children back to school. And I think that what we do know about COVID infection is that typically, most of the time, the complications are very, very low, and most kids have are asymptomatic when they get infected. So you don't even know that they have infection. I think that forcing schools to provide in-home supports for special education is going to be on a school district to school district kind of case in terms of resources within each school district. I think obviously parents have rights, and parents have rights to if they have concerns about the school and the safety for protecting students, they have the right to obviously homeschooling. But in that sense, then the school would have to also provide those supports necessary to provide at-home schooling to continue.
Right, thanks. And this is Susan. I put in the chat a link to the list of parent training and information centers in California. So you can click on that link and it'll show you who's serving which area, and you'll be able to, you can call your PTI and ask to talk to their education advocates or their education specialists and ask them that question. Like, if you want to keep your child at home, how can you navigate the IEPs to get what you need?
Yeah.
Okay.
I think Jessica put in a question in the chat about revisiting the question about pre-existing brain inflammation regarding vaccine. In terms of, children who have underlying inflammatory diseases, things like that, getting the vaccine should not increase their risks at all for their underlying condition. There may be, again, the side effects that we typically see with these vaccines, but again, the side effects that are occurring that we're seeing in teens is very, very, very low.
Okay. And then you see the next question from Maria.
Yeah. So if your child was exposed to COVID last year from a family member, do they have natural immunity until they get a vaccine? They will have some natural immunity. No one really knows how long that lasts. Some people guess between 6 and 9 months that you'll have immunity. But it's still the idea of trying to, when eligible, meaning by age, to get the vaccine as soon as you can.
Another question that has come up in other calls is for people who are on, who have had like kidney transplants and are on certain kinds of immunosuppressants, and we know they're being encouraged to get the vaccines, but the response, the immunity response is different. Have you heard any more about this, about whether there's, are there still studies going on to make sure that that something will work for folks with immune suppression?
Well, I think the goal here is that for those who are immunosuppressed, that is true that it may impact your ability to sustain immunity to COVID or develop immunity to COVID. But I think more importantly, it's getting everybody else around that person who's immunosuppressed immunized to protect them.
Right. Let's all get vaccines so we can protect the people who can't.
That's right.
And Lisa wanted to know, what are you finding effective to help families become more comfortable with getting the vaccine for their child if they're worried about it?
Yeah, I think it's really about kind of the risks of COVID are still remain. And the reason why we're starting to see this decline in hospitalizations related to COVID, and the reason why we're seeing the number of deaths decline related to COVID is really because of the vaccine and people getting vaccinated, on top of kind of the social distancing that we're doing, on top of the masking requirements and wearing a mask in public. All of this is contributing to the decline in the severity of infection. Now, keep in mind, it's not gone away. We're still having kids who have severe infection. We're still seeing some kids with what's called MISC, or multi-system inflammatory condition related to COVID. And to protect as many people as we can, we want to get as many people as we can immunized to protect them. And if you have a child who's 12 and above, to protect your child, it makes the most sense to me to have the vaccine so that you can ensure protection against from others who may not be vaccinated.
Right, thanks. And then, so what do you think, are schools going to require kids to be masked when we return in the fall?
That's a great question.
Or what do you
again,
recommend that they be masked? Let's put it
that way.
Yeah,
I think it depends on your area, right? And so many public health agencies are putting out information around how many people are vaccinated in the city. And if you live in an area where the percentage of fully vaccinated people is very low, and you are vaccinated, you're going to be safe. But if you have a child who's unvaccinated in an area where the vaccination population is very, very low, then I probably would consider wearing a mask at school.
And then is there a website, or are there resources that you would recommend for parents who have children 12 and under, and maybe even especially parents who have disabled kids 12 and under, that they should keep an eye on, that they should watch for more information? Well,
more information comes from the Center for Disease Control. The CDC website is a great resource. They've got a lot of good information. The American Academy of Pediatrics also has great information. around this. Even our Children's Hospital Los Angeles, and I'm sure those who live closer to other children's hospitals will have some information around COVID and COVID vaccine. I think your local public health agency will also have good information on the ground prevalence rates in your community that can help guide your decisions around how to protect yourself the best.
Okay, thanks. And so I just want to put out one more call. Does anybody have any more questions? So now's your chance. If not, we're going to let Dr. Yin go, and the video will be up on our website in a day or two, and we'll share it around.
All right. Well, thank you for inviting me to speak, and I hope we had a chance to address some of these concerns and hopefully answer your questions to your satisfaction.
Thank you, Dr. Yin, and thank you all for joining us, and we'll see you again soon.
All right. Take care, everyone.
Bye-bye.
Bye.